We know fibers are super important for our digestive system. They promote moving foods in the digestive systems, that is regular bowel movements, and reduce constipation. Gut bacteria provide many health functionalities, including their heart and brain axis. Fibers support healthy gut bacteria. It has many more health functionalities, and today we are going to listen to Dr. Mazhar Haque, FRACP. Dr. Mazhar Haque is a senior consultant in gastroenterologist at Mater Hospital, Brisbane, Australia. He is also working at Mater Hill Gastroenterology, a specialist in gastrointestinal and liver disorder. He has been in private practice since 2011 and has wide experience. He is a member of Gastroenterology Society of Australia and senior lecturer in medicine, University of Queensland, Brisbane, Australia. In 2017, he was honored by UQMS Teaching Award.
There are a lot of interest recently in role of gut bacteria in human physiology and different chronic disease condition. More evidence are now known for the role of gut bacteria in different conditions such as metabolic syndrome and metabolic syndrome associated fatty liver disease, brain gut axis, cholesterol metabolism, hence the risk of cardiac disease. Dietary and supplemental fiber are linked with health of gut bacteria. Fecal microbiota transplant has potential beneficial effect on different chronic disease conditions, including inflammatory disease. Not all dietary fibers are equal. Different types of fiber has different role in gastrointestinal system. Fiber can be divided in viscous fiber, bulking fiber, or fermentable fiber. Also, it can be divided into soluble fiber or insoluble fiber. Viscous fibers can slow gastric emptying and small bowel transit. Bulking fiber increase stool weight and reduce colonic transit time. Fermentable fiber converted by gut microbiota to short-chain fatty acid, which help gut barrier function, motility, and immune regulation. Different type of fibers can be used in different ways. Bulking fibers such as soluble fiber would be very valuable for management of constipation. In case of IBS, overall fiber intake can be concentrated on low FODMAP non-fermenting fiber. Fiber is also valuable in prevention of colorectal cancer and diverticular disease progression. Higher habitual fiber intake associated with lower risk of colorectal cancer, diverticular disease, cardiovascular disease, type 2 diabetes, also all-cause mortality. Chronic constipation is a very common issue. Psyllium fiber and bulking fibers, especially the soluble fibers, improves the stool frequency and consistency. Wheat bran helpful but may increase the bloating. In case of irritable bowel syndrome, psyllium improves the global symptoms. Insoluble bran and highly fermentable FODMAP-rich fibers can worsen the pain and gas in many patients. Minimizing those type of fiber would be very useful. In case of diverticular disease, higher fiber intake linked to lower incidence and evidence for supplements in established disease is limited. Colorectal neoplasia prevention is highly related with higher total and whole grain fiber intake, which is associated with lower colorectal cancer risk. Mechanism includes transit, dilution of carcinogen, and short-chain fatty acid-mediated anti-tumor effects. These are all beneficiary effects of fiber. Viscous fiber slows the gastric emptying and small bowel transit, which helps achieving satiety early, and it is very much useful in weight management. Fiber has a very important beneficiary role in glucose metabolism and glucose absorption, which is also useful in management of metabolic syndrome, and non-alcoholic or metabolic syndrome associated fatty liver disease are also dependent on this pathway. So having fiber is useful for managing these conditions. Fiber is also very useful in cholesterol management, and lowering the cholesterol is one of the beneficiary property of fiber, which in the long run helps the cardiac risk factor management. How much fiber is optimal? It's based on your body weight, activities, and gender. Between 25 to 35 grams of fiber would be useful in a daily basis. If you want to optimize your fiber intake, start low, go slow, and also drink plenty of water. To meet that target, also eat whole grain food, fruits and vegetables. Choose your food by reading the labels and try to understand the amount of fiber in the processed food. Fiber absorbs water, so staying hydrated helps it move your system smoothly. Increase fiber intake slowly over a few weeks to prevent gas, bloating, and cramping. If your symptom persists, I would advise you to see your doctor. Thank you.